welcome. My name is Felix Cannibal, and this is the Avatar Home Health and Hospice Show. This morning, we're going to delve into something that is very important to all the families to know. If you haven't dealt with it, believe me, you're going to be dealing with it sometime during your life. And I'm talking about hospice. So today, to help me dwell into this very important service, we have with us Maya Arguez, who is our marketing director when it comes to everything that has to do with social media and blogs and so on. She's the one in charge of that. And not only that, Avatar Home Health, and I'm going to go into it a little bit later, more deeply, but we are a family-owned company, and we've been in business for 20 years. And as the time has gone by, obviously, my grandkids have been becoming part of the company, and Maya is one of my granddaughters. So I'm proud to introduce to you Maya Arguez.
Thank you for having me today. So I guess today we're going to go over some frequently asked questions that you get a lot with hospice care. So the first experience of hearing about hospice, I'm sure, is really overwhelming for families because not only is it a lot of information, but they're now having to trust new people with their loved ones.
Right.
So why don't you tell us a little bit about Avatar and why you started and why they should trust you guys?
Well, actually, if I go back to the beginning, is something we started back in 2005 when I first moved to Texas, and my daughter's a nurse. She's a registered nurse, and at that time she was working as a field nurse for home health agencies. So when I moved to Texas to be close to her and my grandkids, we decided to open our own agency. And when we first started, we were doing home health and caretaker services. So at that time, it was really Avatar Home Health Care Agency. As the years went by, we noticed that when our patients started declining, our home health patients started declining, they would be transferred to a hospice agency, and there was always that pain that people suffer when a relationship that you have for months or years is taken away from you, and that was something very sudden because if the nurse and the caretaker and the home health aide is taking care of you for 6 months, a year or so, there's a relationship that develops. And then you go to the doctor and they find that, you don't have much longer to live. And then the services that you need are better provided by a hospice agency. So actually a home health agency cannot really do everything that a hospice agency does. So then our patients were taken away, and the patients didn't want to do it. The patients wanted to keep their own nurses, our nurses. They wanted to keep our home health aides, and it was impossible. So then we said, well, why don't we get a license for hospice? So we went ahead and got the training for hospice, and we applied for the license, we got it. And in about, I think it was around 2010 that we started doing hospice. And hospice has proven to be, for me and for many of our nurses, something that is very, very powerful, very dear to our hearts. And all I can say, Maya, is that I'm very, very glad that Avatar Home Health became Avatar Home Health and Hospice.
Yeah, so it feels like that made the transition from home health to hospice a lot smoother for a lot of your patients.
Well, yeah, for sure, because now, they know, and of course, and we'll touch on a little bit later, upon this a little bit more later. But the thing that when you go into hospice, it's not an easy thing. Uh, but knowing, as difficult as it is, knowing that you're going to have the same people by your side, that they're going to be with you, they're going to still visit you, and they're going to be there for you until the very end. I think that's very important for the patients. And with Avatar, we have that continuity of care. You know, we can take you from, like, let's say, the least intensive service that we provide, which is the caretaker services. There's not the nurse is not involved. There's no doctors involved. All we do is we have someone that goes to the patient's home and helps them with their daily activities, like taking a shower, going grocery shopping, doing the things that the patients can no longer do for themselves because of their age and because of their illnesses and so on. So from caretaker services, we can, as a patient needs more services and more care, let's say they need therapy and they need somebody to be making sure they're taking the right medication and so on, then we can provide it with home health care. And that doesn't mean that the caretaker services have to stop. You know, both of them actually are combined. Right now we have probably like 200 patients that are getting both services. And some of the caretaker services are being provided by our own agency. Some are provided by agencies that have nothing to do with us, except that they're doing the caretaking and we're doing the home health. And by the way, that could also happen the other way. We do the caretaking and the other agency is doing the hospice. And then from there, talking about continuity of care, so you got the caretakers, then the home health, and then if the patient has a terminal illness and the doctors, you know, are of the opinion that that the end is near, then the patient is better served by going into hospice, and then they don't go to another agency. They keep the same nurse, they keep everything. So there's the continuity of care that Avatar Home Health and Hospice offers that very few agencies in Texas can claim that, because it's a difficult thing. It's like having, imagine there are agencies out there that only do caretaker services, right? There are agencies that only do home health, and there are agencies that only do hospice. So imagine the complexity of running basically 3 agencies in one. But it's such a great thing for our patients. Like, in the caretaker services, there's hardly any profit. So our accountants have said to us, well, why do you stop doing on our consultants? Why do you stop doing caretaker services? You hardly are making any money from it. Why spend all that energy there when you could spend the energy someplace else? And the answer to that is that we care for our patients. You know, if our patients need caretaker services and we can provide it for them, I think we can do a better job than somebody else. So that basically is part of the philosophy, Maya, where we focus on the patient. The patient is our main concern. Our mission is to get that patient to feel better and to get better, and that's Avatar. That's what we do.
Right. So with that mindset, when you're speaking to a new family, what is hospice care for them and for that family?
Well, I can tell you what. Let's start with what is hospice care, right? So hospice care is, and by the way, hospice care is one of the most misunderstood services that there is. Because when you say, I'm gonna go, say, have a colonoscopy, I'm gonna do this. Those are things that are people know what you're doing, what they're gonna do, and so on, or what they're looking for. Hospice is like a stigma, right? So some people say, oh, hospice is when people go and then they die, or they stop feeding the patients, or they take them they take all the medications away. So there's a lot of myths out there about hospice. So what people think about hospice is very, very different. What hospice really is the most compassionate care that I have witnessed, and I've been doing this for over 20 years, is where we have a patient that, in the doctor's opinion, they have diagnosed the patient to have 6 months or less to live, and to continue the treatments, whatever treatments they're getting, whether it's chemo, radiation, whatever treatment they're getting is not working anymore. So with or without the treatment, the patient has a short time to live. And when I say short time, you know, the rule of thumb is 6 months or less. But we had patients in hospice for 2 years because they're declining very slowly. They're dying, but they're dying very slowly. And meanwhile, they are enjoying life as much as they can. So it's not like we're hospice people coming to hospice, oh, you're coming in here to die. No, you're coming to hospice to be taken care of and to help you be able to enjoy whatever is left of your life as possible. And we have had patients that have gone to cruises. We have had patients that go to a different state to have a family reunion, which is, I thought that was a beautiful thing that this patient did. They had patients in different states, and they decided, okay, we're going to meet like a state, that the place that was almost kind of in the center of the family, and they had a big family reunion. They saw relatives that they hadn't seen in years, and basically it was beautiful. And that's one thing about hospice. You get me talking about hospice, and you might have to bring me tissue paper. And I mean it. I mean it. It's something that is very close to my heart. But imagine the beauty of, you know that you're gonna die. You call your family. You got your cousins. You got people you haven't seen for 10 years. They come. They meet at one place, and they say hello and they say goodbye. So that's how powerful hospice can be.
It feels like it's really about letting that patient take control of, that.
Yeah.
What that life looks like. So shifting that focus from being at the doctor's all the time, being in and out of the hospital, to what do they want those last few days, months, years to look like. Right.
Actually, it's like a vicious cycle. And believe me, like I was talking to my son-in-law the other day, and he made an observation that it was very wise. He said, getting old is not for the weak. And that is true. That is true. And believe me, I'm 78, so I'm going through some of those problems now. But yeah, so thank God I must say that I'm blessed. I'm very healthy in comparison, right? Everything is relative. But yeah, people as we age, and we start facing different illnesses, and they become, some of them are really very hard to control. And I'm not talking about cancer now. Cancer is a different thing, right? But you have many other things like renal failure and problems with the liver failure and heart conditions and so on, where the patient is diabetes. I mean, there's a lot of very ugly things, very ugly diseases, right? That they take a toll on the patient. Oh my God, lupus, and it's just, and if you're suffering from one of those, I don't have to explain anything to you, because you're suffering with it, or if you have your mom or your dad going through it, dementia, Alzheimer's, it's not fun. So if you, so that this vicious cycle is the patients is at home, they're not feeling well, you know, they go, the family say, oh my God, my dad is going through this. Oh, what do? They take him to the ER. They call, or sometimes they call 911. Here comes 911. They go to the ER. The ER they put him in observation. They say, okay, let's keep the patient in the hospital for 2-3 days, and then there. Also, this is also due to the way that Medicare works. Then from there, the hospital, the case manager says, well, let's send them to rehab. Now the patient goes into rehab for two or 3 weeks, and then he comes back home. He's feeling better. He's recovered a little bit, and then a month later, oh, I don't feel well, and then the cycle repeats itself. So when you're doing that for a couple of years, right? Then the question, and this is very difficult because when I talk to the family, I'm basically that is a conversation that is a very difficult conversation, and doctors, unfortunately, don't like to have this conversation with the family. And doctors, forgive me, I love you guys, but you know what I'm saying.
It's a hard conversation.
Yeah, nobody wants to have it because it's just difficult. But somebody has to tell them, and I tell them, from the get-go, when I talk to the people, and by the way, you can always do me a favor, write my number down, 281-703-8050. That's my cell number. When you call that number, you're not going to get a receptionist, you're not going to get my secretary, none of that. You're going to get me. That's the same number that where my daughter, my wife, my grandkids call me on. So you get me. So when we have a patient, like now, I think tomorrow or the next day, I'm going to be doing a consult with the family, and this is a typical situation. This mom is sick, 2 daughters. One daughter takes care of her all the time. Another daughter lives a little bit further away. She has to work, and she goes sees her mom as often as possible. One daughter believes that the best thing to do with her mom, which by the way is over 100 years old, the best thing to do with her mom is put her in hospice. The other siblings says no, mom is not. There's no reason why to put her in hospice. And then we look at the chart and we say, yeah, this patient will be better served by hospice services. And the family too, because one of the things that hospice has is that it's not only for the patient, it's for the patient and the family. And now we can go into that in a couple of minutes. But so then I sit down and I tell them up front, I said, this is a hard conversation that you should have had, that should have happened before. Because, your mom doesn't have long to live. And then, of course, sometimes they get mad, sometimes not. But most of the times, they know it. They know it, but they need to hear it.
Yeah.
You see? And when I come out, like, I come into a house as let's call it, as an expert or somebody that knows what he's talking about. Then they can ask any questions they have, So how do we start? How much does it cost? This and any questions that they might have. And then I go and I get that conversation going. And most of the times, they either let us do the hospice services at that point, or maybe in a month or two, they really I plant the seed and it works, and they really believe, they come to understand that the best thing to do for their loved one is to put them in hospice.
Right. And that's an emotional conversation that I think
Yeah.
helps to have the information so you can kind of start to process and start to figure out, once the emotions calm down a little bit, what is the next best step. So one of the things that a lot of people don't understand is where hospice can take place, that they can be in the comfort of their home. So what are some of those options when it comes to where hospice can happen?
Yeah, actually, hospice was designed, and this is controlled by Congress. This is a federal law. So hospice is supposed to happen at the patient's home. Now, where's home? Home is wherever the patient resides. So it could be a nursing home, it could be an assisted living facility, an independent living facility, a group home, or like 95% of the time, it's going to be at the patient's home. So when people think that, I don't want to put my mom in hospice because then they're going to take him to a nursing home, right. And we all know what people think about nursing homes. Then most people say, if it's my mom and they tell me they're going to put him in a hospice home, I'm going to say, no, I want my mom in my house. I'm going to take care of my mom. And most families feel the same. And most patients want to be in their home, in their bed, surrounded by their loved ones. And so we go wherever the patient lives. And so this is the freedom of hospice. Wherever you live, we're going to follow you. We're going to go where you are. If you want to eat whatever you want to eat, we're not going to tell you not to eat it. We're going to tell you, of course, if you have high blood pressure and stuff like that, you should still be careful with that, because who wants to have, a spike in their blood pressure? Nobody. But without doing anything crazy, you basically can eat anything you want. You don't want the nurse to go today? We don't go today. You want us to go once a week? We go once a week. You want us to go, you want the services once a month? It doesn't matter. We want to make you comfortable. And in many cases, like with cancer patients, there's pain involved. So if there's pain, we want to minimize it. So if we have a patient that the pain level says number 8, we want to bring it to number 1 or 2, if possible, maybe to 0, which possible. And so we manage that. And on the other hand, we don't want to have the patient medicated all the time where he or she's a zombie and not being able to enjoy life. So that's what we do. We talk to the patient and the family. I said, where do you need help? When do you need help? And we work out a plan of care with the family. That plan of care is taken to our medical director, who's a doctor, and the doctor looks at it and say, yeah, of course. And because, again, it's not like in home health, where we're trying to help the patient get cured, for lack of a better word. We just want the patient to be comfortable, pain-free, and as happy as they can be under the circumstances. And that's as simple. So do not be afraid of hospice. Hospice is really, if the person is diagnosed with, the patient state, the prognosis is, this patient is going to die within 6 months, 3 months, a year. So the best option for that patient is hospice, right? So if there's a cure, if there's, fight like hell, because who wants to die? Nobody wants to die. But when the time comes, we need to accept it and do the best we can with the rest of the time we have.
So let's say this is really resonating with the family. What does that first step look like? Do they need to wait for their doctor to bring up hospice, or are there steps that they can take first?
Well, no, I think that if the family, especially when the family is having home health care, like with all our nurses and all our CNAs and even the people in the office, our office staff, we're all trained in not only home health but in hospice. So we cross-train every single person in our staff. And we have 150 of them between the field personnel and the office personnel. We have approximately 150. And any of us can answer questions about hospice. Any of us, our nurses can take care of a home health or hospice patient. The caretakers can do that too. So if we have a nurse in the house once a week or twice a week, and the nurse is seeing the patient, and the nurse sees a pattern, and this happens sometimes, it happens. And the nurse is the first one to notice it, then they talk to the family, and it might be something like, I noticed your mom is forgetting a lot of things, and she have lost 8 pounds like this month. Is she eating well? And yeah, she's eating well. No, now that I think about it, now that you ask me, no, she's really losing her appetite. I mean, and this is just an example, right? So then we start noticing that there's certain changes that are happening, and they're not for the best. It's really the patient begins to decline. And then we watch it, and if the patient, we advise the family to have a consult with the doctor. Sometimes it's so evident that the patient is appropriate for hospice, that we ask permission with the family. I said, do you mind if we talk to your doctor, to the patient's doctor? And then we talk to the doctor, and we ask them, what do you think? We've been noticing this patient declining. They have COPD or CHF or renal failure. What do you think, doctor? Right. So then the doctor looks at it, because maybe, remember, the doctor doesn't see the patient but maybe once every 90 days, unless there's something wrong with the patient. But if the patient is like nothing is changing, and sometimes the family doesn't notice it, but our nurses are trained to notice those changes, then they go to the doctor, and the doctor's going to do an evaluation for the patient. Or in some cases, like they haven't seen a doctor for 6 months, a year. Sometimes they don't have a PCP, they don't have a doctor. That's very common. So then we have our doctor visit them, and our doctor will do an evaluation. Of course, we don't do that with every patient, but we do that when our nurse and our director of nursing and our medical director, they say, hey, yeah, this patient is probably appropriate for hospice. So then we have our doctor go visit them, and then he can really assess whether it's appropriate for hospice or not.
Right. And I think one of the reasons a lot of people don't go to the doctors is because of cost, and that's another big misconception with hospice, is what does that cost look like?
Well, now, if you're over 65 and you have either Medicare or Medicaid, you have approximately zero cost. So I don't remember the last time that we sent a bill to one of our hospice patients. Actually, we have never done it, because Medicare or Medicaid, one of the two, are going to pay for our expenses, and that's it. There's no cost involved, no copayments, no deductibles, no surprises. Up front, we're going to tell you, we guarantee you, we're not going to charge you a penny. We're going to be. Now, what happens if Medicare doesn't pay us? We don't get paid, period. It's not like we can go to the patient and say, oh, here, Medicaid didn't pay us, or Medicare didn't pay us. or the insurance company didn't pay us, here's your bill. That's not going to happen because that's illegal. So if that has ever happened to one of your relatives, call that agency and tell them, hey, I want my money back.
I know that can be a big relief for the families to hear that.
Right.
This isn't thousands of dollars coming out of their pocket every month. This is covered, and they're not going to be any back pay. They're not going to have to pay anything.
No, not at all. Nothing.
So once they have started this service, what does that look like? What is the hospice team that they're getting out of this?
Okay. So so the hospice team. So according to Medicare, the hospice team is going to consist of a doctor, a registered nurse, a chaplain, and a social worker. That is the definition of a hospice care team. However, it's more than that, because with those 4 people, we could not do a good job. So we provide not only the nurse, but we provide a CNA. What is a CNA? A certified nurse's assistant, or sometimes called a home health aide. So we have the nurse, we have the home health aide, we have the visiting doctor, we have the chaplain if the patient wants it, and we have the social worker if the patient wants it. So as I said before, we work the plan of care with the patient and the family. However, we always advise the patients to at least meet the chaplain one time, face to face. It doesn't matter if you're not a believer, that's okay. If you're a believer, right. You're not a Christian, that's fine. If you're a Muslim, you're a Hindu, whatever your religion is, it doesn't matter. The chaplain has been trained to talk to people of different faiths or of no faith at all. So just have the first conversation. You meet our chaplain that happens to be a wonderful person, very energetic, and patients tend to love her, period. So you meet our chaplain. You want her to visit you once a month, once a week. You want her to bring your communion. She'll bring your communion. You want her to read the scriptures. She can do that. So it's up to you. You don't want to see her again? Don't see her again. You want to see her 3 months? 3 months you change your mind? Hey, I want to see the chaplain? We'll send you the chaplain. The same with the social worker. Now, what is the social worker going to do? The social worker is going to make sure that you have all your paperwork ready. What is that? A medical directive, and a DNR, which is a do not resuscitate form, if you want it. If you don't want it, fine. So in other words, there's nothing that you have to do, right. But there's a lot of things that you ought to do to alleviate the what your family is going to be facing when you're gone. Because if you die today, your family has to make sure that you get a proper burial. That she wanted cremation? That she wanted to be buried? That she wanted to have a funeral for? She wanted, But don't let your family guess what you wanted. Have a conversation and put it on paper. That way, the siblings are not, and this happens. Patient dies. Now this sibling wants to do this, and this sibling said, "No, mom didn't want that. Mom didn't wanted the other thing." So, let's do it when there's no emotions involved. Let's talk to the patient. How would you like to go at the end of your travels? Right. How do you want to be? Remember, how do you want to do? And you put it on paper, and then when the patient passes, it's very smooth, and the pain is there, but with less headaches.
So really, the team addresses physical, emotional, spiritual connection to the extent that the patient and family want the help, want the guidance.
Yes. So So it's very comprehensive. So like you say, you have the physical, or medical, because you have the nurse involved, you have the CNA involved that is going to help the patient stay clean, and they help them with the bath and so on. And then you have the doctor making sure that the medications are all in order, and if in case we need a medication, it gets to the patient's home in less than 2 hours, or between 2 to 4 hours. Then you have the social worker taking care of the emotional, because the social worker is also a trained counselor. And then you have the chaplain for the spiritual. So there you go. You have the physical, the medical, the spiritual, the emotional, the most beautiful service that anyone can get. And this service doesn't only extend to the patient, it extends to the family. So now, we're not going to provide nursing for the family or a doctor to the family, but we are going to include the family in the counseling and the chaplain services if they want to be part of it. If not, now, to let you know that, so you get an idea of our service, because there's 800 agencies in Texas. So why choose Avatar Home Health and Hospice? Well, I can tell you something. Most of our hospice services, or hospice patients, when they pass, their families want our chaplain to do the service. They don't want their priest. They want our chaplain to go to the funeral home and have the services, or sometimes we have the services at the patient's home. So Avatar Home Health and Hospice is a caring agency. Every single one of us, and that's the number one quality of any of our employees, whether you're a nurse, a CNA, a staff member. If you're not a compassionate person, if you don't care for other human beings, if all you care is for a paycheck, go to another agency. We don't need you. And that's as simple as it gets when it comes to Avatar Home Health and Hospice.
So before we close, what's one thing you wish more people knew about hospice care?
Well, one thing, that's a hard question to answer, but really, what I want people to know about hospice is that it is the best thing that you can do for your loved one. There's not anything else when it comes to the end of life. There's nothing else. And I put as much money on the table as possible. I'm not a gambling person, but I bet you anything that there's nothing more helpful for the patient and their family than hospice services. Now, once again, I invite you to call me. Call me at 281-703-8050, or go to our website, avatarhomehealth.com, and then call me up. Well, I can visit. If you want me to go to your home, I'll go to you. We set an appointment. I'll go to your home. I'll talk to whoever the loved one is that is sick. Maybe they don't need hospice now. Maybe we can have their better help, but with home health, or just with caretaker services, or no services at all. It doesn't really matter. All we want to do is to help you. That's it. That's Avatar Home Health and Hospice.
So if they do want to learn more, they can find us on social media. They can find us on Instagram, Facebook, LinkedIn. You talked about our website, and then they can call you for a free consultation anytime.
Exactly. We're here to help you. There's no sales. There's no out of pocket. None of our services except one. You have to pay us anything, and that's private pay, which is, that's when the only service where you pay. So I think that this is the end of this blog. We're going to have more blogs to inform you about all the services and other things that go on with the care of senior citizens, because that's in reality that 99% of our patients are seniors. So, but we thank you for listening. And one more time, my name is Felix Cannibal. I'm with Avatar Home Health and Hospice. Today we had Maya West, our social media marketing director, and we'll see you soon.